In this video, we'll be looking at two of the most effective treatment options for nightmare disorder. Nightmares are vivid and dysphoric dreams which are usually accompanied by feelings of anxiety and terror and an effort to escape a threat, danger, or fear. It's estimated that 4 to 10% of the population suffers from frequent nightmares. And when the frequency and intensity of nightmares start to impair people's daily lives in areas such as their social, personal, and occupational lives, then they could meet the diagnostic criteria of nightmare disorder and need clinical intervention. It's important to consider that nightmares become increasingly dangerous for people who also suffer from mood or personality disorders, such as PTSD or bipolar disorder. Almost 90% of those with PTSD suffer from frequent and disturbing nightmares, and it's been found that people with mood or personality disorders who experience frequent nightmares are at an increased risk for suicidal thoughts and suicide attempts. So effective treatment options become essential. There are many pharmacological and non-pharmacological treatment options for nightmare disorder, such as antidepressants, hypnosis, and lucid dreaming. However, we'll be looking at two treatments which were given Level A recommendations from the American Association of Sleep Medicine, prazosin and imagery rehearsal therapy. Let's begin by looking at prazosin. Prazosin is a pharmacological treatment option for nightmare disorder. It's an alpha-1 adrenergic receptor antagonist, also called an alpha blocker. While it's most commonly used to treat hypertension, it's also prescribed for nightmares. So, how does prazosin work? Well, prazosin slows down the alpha receptors in the central nervous system. Alpha receptors are responsible for regulating blood pressure, so when they're slowed down, they dilate our blood vessels. When our blood vessels dilate, our blood pressure lowers. This is how the medication is used to treat high blood pressure. However, in the case of nightmares, the dilated blood vessels decrease the activity in our sympathetic nervous system. Our sympathetic nervous system is responsible for our fight or flight responses when the body feels threatened or in danger. So since prazosin slows down the sympathetic nervous system's activity, it blocks the stress response and reduces the startle and fear response. It's been theorized that this decrease in stress, arousal, and sensitivity during sleep decreases nightmares. A 2021 study found that prazosin decreased nightmare frequency by almost 50% in veterans suffering from PTSD. Prazosin is also prescribed with pediatric patients and has shown to significantly decrease nightmares as well. While prazosin has shown to decrease nightmares, it's recommended that patients also attend psychotherapy as well, such as cognitive behavioral therapy, to address the root of their nightmares like traumas or phobias. That being said, treatment for nightmare disorder isn't limited to pharmacological options. Treatment is also found within psychotherapeutic settings. Imagery rehearsal therapy is a non-pharmacological treatment option within the cognitive behavioral therapy techniques. So how does imagery rehearsal therapy work? Well, during IRT, patients first engage in a psychoeducation phase with their clinician where they discuss the client's goals and expectations. Next, patients rework their nightmares and create different and more positive endings to them. Rescripting also involves focusing on altering the sensory aspects of the nightmares and soothing and neutralizing the previously associated negative emotions. Then, they practice and rehearse imagining the new narrative that they've created. For example, if a client has nightmares about being surrounded by sharks, they could rework their dream and rehearse imagining that they're swimming with dolphins instead. How does IRT treat nightmares? Well, IRT instills a sense of control and mastery within the patient, which reduces the distress associated with their nightmares. It also reduces cortical hyperarousal and emotional arousal associated with nightmares. A 2018 study found that after a 15 to 20 week IRT treatment period, the number of nights per week that participants would experience nightmares decreased by almost 70%. In addition, a 2012 meta-analysis reported that the improvements experienced from IRT were sustained at 6 months post-treatment and 12 months. Overall, multiple pharmacological and non-pharmacological treatments for nightmare disorder exist. Prazosin and imagery rehearsal therapy are two of the most effective treatments out there. While prazosin treats nightmare disorder from a neurochemical perspective, by reducing the brain's stress response, it's recommended that it be paired with additional psychotherapy treatments such as IRT, as it's been shown that once prazosin is stopped, nightmares reoccur. Imagery rehearsal therapy on its end helps the patient feel in control of their nightmare and decreases cortical arousal. By treating nightmares as efficiently and as early as possible, vulnerable populations such as children who have faced abuse and those with PTSD lower their risk of experiencing suicidal thoughts and potential suicide attempts.